Yes, and we're back here in What's Up Though. Of course, I promise we talk about pregnancy, we talk
Yes.
about beauty, we talk about health, and now we'll be talking about lasers.
Of course. Ano bang pinaka-common na problem
Yes.
ng mga after mga nap?
Usually yung
diba?
stretch marks, Dr.
Stretch marks talaga yan.
And that's one of the most, I could say, debilitating problem for the women who have like those, what you call sa Tagalog, kamot.
Mga
And,
kamot, oo.
and then in layman terms, is stretch marks. And of course, we have our expert here, a cosmetic surgeon, medical associate of Johnson Cosmetic Surgery,
Yes.
no other than Dr. Rayran Lao. Good morning, Dr. Lao.
Good morning. Good morning, Dr.
Jonna
Lao.
Cenica.
Yes,
And good morning to all the televiewers of What's Up, Doc.
Yes, of course. Together with us, also our nurse, Miss
Yes.
Jennifer Huntalan. Hi, Jen.
And our
we call her Jen.
subject.
Tago natin sa pangalang
Lucette.
Lucette. Ayan. Of course, yes.
Actually, alam mo si Miss Lucette,
Ang
she
history
is,
niya,
she's
ah,
the sister of one of the very popular DJs
yes.
sa ating FM radios.
Of course.
Si Miss Christine Dera, if you guys are,
Yes,
you
yes.
know,
Siya,
familiar.
napakaganda ni Miss Lucette.
Kamukha actually. Kamukha
Oo.
ni Christine Dera
Of
eh.
course. Ang history ni Miss Lucette is that she just got pregnant
Yes.
and then she just delivered a baby
4
4 months ago. Yes. And now she's having this problem. We call it stretch mark or striagovidarum or tinea alba.
Yes,
Of course,
tinea
together with us. Initially, what about preparation na ginagawa natin dito, Dr. Lao?
Yes, initially, siyempre we clean
Yes.
yung area
Okay,
na
clean muna yung area,
target
yes.
area natin.
With
no?
alcohol,
Yes,
is
with
that right?
alcohol or
Okay.
kahit simple NSS or water will do. And then after that, siyempre kailangan natin lagyan ng topical anesthesia.
Topical.
Topical lang, no need for a local anesthesia. Okay?
Pinapahid
when
lang
you say
ito.
So talagang
topical,
walang pink kasi it's just a
pinapahid lang
cream
ito.
anesthesia.
Yes.
Cream
right?
anesthesia.
And then after that, we wait until mga 30 to 40 minutes and then we can do the procedure.
Okay. Yes, of course. Sige, we'll start na. So what is the use of these plastics?
Okay, ito para lang matakpan yung topical and
topical
then
anesthesia. Para magstay.
Yes, para magstay at para
Okay.
makita mo kung nasaan lang. Minsan kasi kumakalat yung topical na pinahid mo kahit doon sa walang stretch marks.
Right.
So minsan malilito ang doktor baka
Oo.
Saan lang
kahit
yung may...
yes.
Yeah.
oo.
And of course, we have some mga protections and
Ano ba to?
protection sa ating sa ating
Yung mga-
mata.
Oo.
And of course,
Kasi laser ito, so kailangan talaga.
so we have to protect the patients, of course, the
And
doctor.
of course, the doctor.
Yes. While Dr. Lau is doing it, I mean, there's just removing some of the topical anesthesia that was placed on the abdomen where the stretch mark will be, well, this laser will be put in, and then is there any pain ba after this, even though there's a topicals?
Kung sobrang baba ng tolerance ng pasyente, actually merong kaunti, pero
Yes.
very
May
tolerable.
konting sting.
Yes, very tolerable. Siguro out of the many patients na we had done this procedure, siguro once lang kami nag-prescribe ng pain reliever. And usually nawawala naman to in less than 24 hours.
Okay.
For our televiewers, of course, you can ask your questions or any comments regarding our discussion
Start tayo, ha?
for what we call it removal of stretch mark using a laser, CO2 lasers. And there's in our screen, it's 0922-891-6761. Please indicate your name and your location where you are at right now. And now, Dr. Lau is
Kamusta?
doing the
Okay
laser treatment. And of course, together with us is our patient who just gave birth 4 months ago.
4 months ago.
So that means, Doctora, after this ba, there will be a very nice abdomen, The stretch mark will be removed.
Actually, stretch marks are not really removed totally, like 100%, di ba?
Yes.
Dr. La was telling me a while ago, it's more on making the stretch marks very, or less noticeable,
Yes.
actually.
That's true. And the good thing here, this is an outpatient procedure. So the patient, doesn't need to be confined in the hospital,
Yes.
and at the same time, they can go home. So nobody will know that there
Actually,
was a
kahit
treatment done
break
after
time,
this
hindi daw yung
procedure.
lunch break treatment. Or
Lunchtime
procedure.
treatment. So that means that the patient could go back to work during the, after lunch break. No? You don't need to be taking a lot of medications, confined in the hospitals, as I've said. And now,
Yes.
Dr. Lau, what are the precautions that we can advise to our televiewers if they want to undergo this kind of treatment?
Okay, for the precautions, halos medyo minimal with regards sa abdomen. Unlike
Okay.
sa other parts of the body like the
Yes.
face.
Sa abdomen,
Sa
ano
abdomen
bang
halos
ano
wala
natin?
masyadong precaution except kapag may active lesions. Ibig sabihin
Okay.
po nun is kapag may sugat.
May sugat. Bawal
yung
kapag may
bawal
sugat ang
muna,
tiyan. Okay.
yes, oo. Pagagalingin muna natin. No?
Okay.
With regards doon sa pinag-usapan nyo kanina na how soon can a patient undergo a CO2 laser
Yes.
after pregnancy?
Kasi siya
Yes.
4 months.
4 months.
Tama ba?
Actually,
Oo.
minimum of 3 months.
So,
Oh,
3
3
months
months,
pwede na.
okay.
But actually, pag pwede mo i-postpone ng mga 6 months, kunyari talaga medyo iba pa yung pakiramdam ng pasyente, we move until 6 months.
6 months,
Yes.
okay. Now, what are the, let's say, of course, this is an outpatient procedure. What are the things that you can advise to the patient after doing the lasers?
After doing the laser.
Okay.
Is there any other cream, some bleaching agent, and what will be the possible initial results?
Yes, okay.
of the
For
laser?
the initial result, makikita mo yung area na trinate is magiging reddish, which is very common. Parang na-sunburn sa face.
Parang
Ganun yung
sunburn.
magiging
Okay.
itsura sa ano.
Okay.
Sige.
You
they,
just
they
have
don't,
to...
they don't need to be alarmed. no?
Yes, you
Okay.
just have to assure your patient na that's normal. That's a normal
Okay.
process of the CO2
Right.
laser. And then afterwards, don't use yung mga strong soaps. Use yung
Mild
muna yung mga
muna.
mild hypoallergenic.
Unscented, mga ganyan.
Yes.
Okay.
Yeah.
And then, wag ka munang gagamit ng mga peel. Kunyari, naglalagay ka ng mga peel, bleaching agent.
Wag
Mga
muna.
bleaching,
muna.
mga chemical
Yung mga
peel.
Yes, the
lotions,
doctor will
okay.
advise you when to use or when to continue yung mga normal regimen mo na ipinapahid sa katawan.
Okay.
Wow, napaka-easy pala naman ang
So,
procedure na yan.
as of now,
It's not really that much. It's not really very tasking for you to undergo this kind of procedures. Number one, you can go back to work. Sabi
Yes.
nga, lunchtime treatment, And then, now, ano ba talagang effect ng lasers to the stretch marks,
Okay.
Doctor?
Actually, kanina nanonood ako sa topic nyo kanina kay Dr. Kwan. Sinabi niya breakage ng collagen, which is
Yeah.
very true.
Right.
This laser, once na pumasok ito sa inside the skin, it stimulates the collagen inside.
Formation.
collagen.
Yes,
Okay.
collagen formation. Yung breakage na magkakaroon ulit ng reaction to stimulate another collagen.
Yeah.
That's why makakakita ka ng reaction within 2 weeks, 3 weeks, 3 weeks, makikita mo parang nagla-lighten.
Yeah.
Yung mga depressed mo na stretch marks, medyo nagpa-plump up.
Yes.
Yun yung
Okay.
magiging result
So,
niya.
meaning hindi lang siya sa stretch marks.
Actually, marami siyang
Marami
use.
siyang
Ginagamit.
uses.
Yes.
Okay. So, pwede siya sa mga scarring.
One of the most
ng,
common causes talaga is the acne scars. Second
Acne
is
scars.
the stretch marks.
So, yung mga tinatawag na acne scars na malarami sa face, pwede rin
Eto,
pala yung
eto din pala.
laser.
Yes.
Pwede rin pala.
Actually, may
Ibang
nagtatanong
settings
kanina,
lang ata, diba?
paano daw sa lalaki eh. Sabi ko, pag nakamot ng misis,
Oo.
Pwede. Ating cameraman. Well, we have a texter from cellphone number ending at 7626.
Okay.
Doktora?
Hello, from Girly of
Okay lang,
Taguig.
sir.
Hi, Doc. I am
Breastfeeding.
breastfeeding. Is it okay to undergo CO2 laser? Will it not affect my breastfeeding?
Ayun.
Ayan.
Nagpapa-breastfeeding daw siya, doctor.
yes.
And
May
meron daw bang
contraindication ba
epekto
tayo?
sa
Actually, Lucette
contraindication?
is also breastfeeding right now.
Ah, okay.
Oh, reset.
So,
Pero
si
ang
Lucette.
advice namin is after 3 months. Yes. Actually, the laser, hindi naman nakaka-affect or na-absorb ng katawan mo to. It is
correct.
actually skin deep lang.
Okay, it's
deep.
So,
just skin
hindi
deep.
So, that means-
makaka-affect ito sa breast breast production
So,
ng
girly,
mother.
pwede ka magpa-laser after 3 months postpartum or after pregnancy.
Yes.
There's no problem.
So, there will be no problem. So, kailangan dumaan muna ang 3 months bago magpa-laser siya and wala epekto sa breastfeeding. Okay. Wow, well, be very interesting.
Oh, I just
ha?
want to ask you, Miss Lucette, how are you feeling right now? Does it have a little sting or
Any pain
masakit
or
ba
whatsoever.
siya?
Pero, very comfortable siya.
very tolerable?
Yeah, that's a good, nice answers. How about si Miss Jen? How do you feel?
Actually, kay Lucette is very minimal lang, no? Yung
Minimal
stretch
lang,
marks
oo,
niya.
minimal
Yes.
lang.
Ina-advise natin sa pasyente, siyempre yung prevention din talaga. Pag pregnant yung pasyente, kailangan dinalagyan ng mga lotion, moisturizers during pregnancy.
So, prevention muna
Prevention
talaga.
muna. Para, actually, hindi naman talaga totally 100% na mawawala yung stretch marks mo pag naglagay ka nun.
Oo.
But rather, pag lumabas na yung baby mo, less yung stretch marks na makukuha mo.
Is this a, doctor, is this a 100% improvement?
After
laser?
the first session, hindi 100%, but definitely merong improvement.
There will be improvement.
The interval of the treatment is one month and 2 weeks or 6 weeks.
Okay.
Doon mo pala makikita kasi minsan medyo matagal yung stimulation ng collagen inside the body, kaya nag-aantay tayo ng 6 weeks.
Okay.
Minsan
So
kasi
6
nag-e-effect
weeks.
pa ang collagen inside the body.
Okay, wow.
Pero doctor, may I ask lang, ilang sessions ba usually?
Yeah, per treatment para makita
Kunyari
mo
ganyan, yung sa stretch
possible
mark
real
sa
results.
abdomen.
2 to 8 sessions.
2 to 8
yes,
sessions.
2 to 8 sessions.
So it all depends. Maraming
Yes,
factors
depende
na
kasi may individuality ang pasyente.
Yes, yes.
Lucky for you, if mabilis ka mag-react, kunyari, maka less than 5 sessions ka, okay sa'yo, mas mabilis. But sometimes may mga pasyente talaga na matagal mag-react yung collagen nila. It takes a little longer.
Yes. Is there any side effect regarding this procedure, doctor?
Side effect, yung mamumula.
Yun
There will
lang.
be redness.
Yes.
Aside from
Okay.
that,
Does
wala.
this
Halos
redness
wala
can
na.
disappear after a
In
while?
less than 24 hours, yung redness magiging pinkish na yan.
Can you apply some bleaching agents? Let's
No,
say.
bawal. Usually, ang
For at least how long?
1 week.
1
One
week.
week.
Minsan
Okay.
tinitignan ng doktor, ang pinaka-the best na ilinalagay minsan is simple petroleum jelly.
Petroleum
Remember,
jelly.
the CO2 laser penetrate your skin. So meron
Napakasimple
kang-
naman pala ng procedure na
yes,
to.
petroleum jelly lang. Can cover up to prevent infection. Okay? And then, after the CO2 laser, ina-advise natin yung pasyente na huwag mag-wear ng mga fitted clothes.
Fitted
Medyo
kasi-
Loose
Yeah.
muna.
para hindi tumama dun sa area.
Doctor, paano kung halimbawa, after 1 week, the patient wants to go swimming, magbe-bathing
Yeah.
suit, kunyari si Lucette, meron siyang outing, pwede bang
Yung mga
sun
activities
exposure
niya.
dyan? Okay
Mas
lang ba?
magandang hindi.
Okay.
Yes.
Till how long?
Depende. Titignan ng doctor, kunyari medyo nagsusubside na yung swelling sa abdomen.
Okay.
Siya ang magsasabi. Actually, sa
Okay.
case-to-case basis, kung
Okay.
pwede
That
na
would
siya
be nice.
mag-swimming. Yes.
Oo. Yes, yes.
So, may mga limitations sa mga let's say kung athletic ka, medyo you have to
Wag munang sun
have a
exposure.
consultation with your
Yes.
physician.
Always
who
keep in
undergone
touch with
basic-
your doctor after doing a
Oo,
procedure.
yan ang
lagi.
tama. Yan ang
Yes,
tama.
importante yun.
Yes.
Yeah, doctor, do you had to take like mga antibiotics after the treatment?
No need
No need
na
na, no?
mag-antibiotics.
Or any
yes.
topical antibiotics?
Wala naman.
Wala rin.
Wala rin.
So,
Sige.
Wow.
isa lang sa sinasabi namin sa pasyente, lalo na dito sa is avoid na magkaroon ng pawis or mapawisan ka.
Okay.
Kasi once na nagkaroon ng pawis at nangati yan,
Baka
may tendency
kamutin mo.
makamot mo.
Ayun nga,
At
sometimes
yun-
you just give probably mga antihistamines.
Yes, antihistamine.
So,
will
yun
do.
lang.
Especially during nighttime,
Yes,
no? Kasi
yes.
Subconscious.
Subconsciously.
Oo,
kung
subconscious.
Nakakamot
gabi
nila.
na nangangati, so you have to take some antihistamines for the itchiness. But actually in reality and in totality, wala masyadong preparation,
Oo,
and it's
wala
just
masyadong
like what you call
downtime.
lunchtime treatment wherein the patient could go home after the procedure, no?
Actually,
There's no even bleeding, ha? Walang
Yes.
bleeding.
Wala.
Actually, si
bleeding.
Lucette mamaya maglalaba pa, magluluto pa.
Oo, kaya siyempre
So, walang
mag-aalaga ng
problema
baby.
doon. Okay
Yes.
lang. Okay.
So, hindi sila So, the earliest, at least 3 months, ha?
Yes,
3
3
months.
At
months.
least 3
yes.
months.
Yes, wow. Wow, doctor, we don't have so much time, and our cameraman is giving us 3 minutes more to tell about the lasers and where
Oo.
can you find you.
Dr.
And,
Lao, sige, where
yes.
can they find you ba?
Okay, you can find me at number 8 Acropolis Center in Bagumbayan, Libis, Quezon City.
Yes.
Johnson Cosmetic Surgery. It's located on the 2nd floor. Sa baba po niya is Causeway Restaurant. And our telephone number is 667-3491. Again, it's 667-3491. You can find me there at Monday to Friday po.
Yes, of course.
Okay.
And of course, we would like to greet the staff of Janssen from Angeles City. And
Meron pa ba?
of course, si Ange Nordel from Angeles. And yung nabit namin mga kaibigan namin, sila J. Sangkap from San Fernando. And we'd like to greet the people who attended the Miss Philippines
Yan,
Earth
side
Gown
view ako.
competition. Of
Sige
course,
pa.
with Miss Pichi Veneracion.
Yes.
And the rest of the staff of Miss Earth. Chris Anton is here. And of course, I'd like to thank Miss Jennifer Intalan. Bigyan natin siya ng, yan.
May exposure si Miss
exposure,
Jen.
Yes. And of
oo.
course, the staff of Janssen Cosmetic Surgery of Manila and Quezon City in Libis. Of course, si Joy, si Rhea, Hershey's, and Aya, and the rest of the staff.
Oo,
And
yes.
of course, together we'd like to thank some of the crews and cameraman of Global News Network. And of course, you can log on at www.johnsonscosmeticsurgery.com
Sensitive
and
naman.
our Facebook.
Of course.
Please like us on Facebook.
Please
Again,
like
may
us on
mananalo na
Facebook.
naman.
Yes, and just type in Janssen Cosmetic Surgery, and also i-add up nila and like the page of What's Up Doc on
What's up,
Facebook.
Doc? And of course, my Facebook, Jonna Cenica. You can see us again live, on Facebook. And tomorrow will be on replay at 12 noon.
12 noon.
Here, of course, at Global News Network, Channel 8 on Destiny Cable, and Channel 1 on G Satellite.
Of course.
Of course,
And
Doctora?
I would like to thank Janssen Cosmetic Surgery. You can call them at 521-1444 and you can PM them for your questions in their Facebook account. Just like Janssen Cosmetic Surgery. And also, I would like to greet every mother. Happy Mother's Day!
Happy Mother's Day to my
Happy
wife,
Mother's
Jonna
Day.
Cenica. Of course, my very good son,
Hello,
Justin,
Justin.
and Jo Marie. Yeah.
And I would like to greet the Nokan and Tumambing family. And of course, I would like to greet my Happy Mother's Day to my tita, my mom, and my lola. Happy Mother's Day to you guys.
Thank you. Happy Mother's Day to everybody, to all
Love,
the mothers. Our mother here. Thank you
Happy
very
Mother's
much.
Day, Miss Lucette.
Yes, and of course, you can call us at 521-1444 for any information regarding beauty. And the winner is Miss from Taguig, si Miss Pearly.
Yes.
Yeah, siya ang
Miss
nanalo sa
Taguig.
atin. Okay? So, I'll see you again next week and for another episode of beauty episode and health episode of What's Up, Doc. This is Dr. Jonna Cenica.
And Dr. Jonna Cenica for
Okay na?
What's Up,
What's
Doc?
up, Doc? See you next week.
There's a tear in your eyes, I know. I can feel that it's not been